Now, we also need to think about group rules and group norms. In many ways, our group norms and rules provide the containment or the structure for safety and the expectations for participation in the group. Now, there's lots of simple group rules that we can implement to promote a sense of safety for trauma survivors within our therapy groups, including commitments to confidentiality, which most of us probably already use, commitments to mutual respect. And another commitment I like to use, another rule I use in my trauma therapy groups, is a commitment to ask permission before engaging in any kind of physical touch more than a handshake or a fist pound. That because trauma often leaves us with our nervous system being on edge or hyper aroused, and so many people experience trauma because of inappropriate or violent physical touch. When that's really up for people in therapy, it can really be activating to experience unwanted or unexpected physical touch, a hand on the shoulder or a hug. And so, in all of my trauma therapy groups, I have some sort of rule about asking permission for physical touch. So, these are three rules that I use in pretty much any of my trauma therapy groups or more involved experiential therapy trainings as well. Other rules are going to be important to include depending on your group and your treatment setting. Like, for example, there might be rules in your agency that you have to also enforce, or there might be other rules about, like in an outpatient setting, you might have to have rules about people using their phone or silencing their phones during the group. Or in an inpatient setting, there might be other rules related to identification of clients being visible at all times, or food or drinks in the group room. These rules are going to vary from organization to organization. Other rules and agreements might relate to attendance and timeliness, being there on time, rules related to the financial aspect and payment for the group, and even other dual roles in the group. So we might need to create a rule about group members having contact in between group settings. And many group therapists will have a rule for their outpatient groups that individuals are expected not to talk to each other in between sessions or exchange phone numbers. Other group therapists, depending on the populations they're working with and the settings that they're working in, opt not to enforce that role or create that rule for their groups. As someone that's participated in therapy groups myself and facilitated outpatient and inpatient groups, I actually find that there's a lot of value to the relationships that are formed within the group and how those relationships can be a source of mutual aid and peer support in between group therapy sessions. So I don't include that in my rules. If I was working with different populations, I might include that in my group rules. It also helps to have norms related to choice within the group process, especially if we're doing trauma therapy groups. Anytime I'm doing trauma therapy, one of the first things I do is I affirm each client's right to choose how much they want to disclose and when and how, to disclose their trauma in a general way, in a specific way, to observe for some time before participating in the group, to choose not to share in the group, to choose how much they want to be involved. And that's really about safety. That if we're forcing people to do trauma therapy and to talk about their trauma, that's not going to be helpful, and it's potentially going to be harmful. It can help to have a norm related to telling war stories about trauma. I always say at the beginning of my inpatient trauma therapy groups that this isn't a place where we're just going to sit in a circle and tell war stories about trauma. That's probably not going to be helpful. Might be re-traumatizing for folks, might be vicariously traumatizing for others. And just retelling the trauma story again and again and again without doing the other important work might just be strengthening the neural pathways related to that trauma memory and associations attached to it. So I always have some sort of norm related to telling war stories about trauma, that there's a place for telling the story and the details of the trauma. And when we get to that, there'll be a structure and containment for it. And I'll be really explicit with the group about, all right, now the prompt is, I want you to share one thing you're ready to talk about as it relates to a loss you experience or a trauma. I have a really specific prompt in a group setting when we get into details of the trauma, and that helps contain things. It can really help to have some sort of ritual for each group session about reaffirming and recommitting to group rules and group norms. So in my groups, what I do is whenever there's new group members, I spend a bit more time talking about the different group norms and the group rules. When I have a session and there's not any new group members, I very quickly go over the group rules and I ask everybody to commit to them, regardless of if there's new people or not. The method I like to use to have people commit to the rules when I'm doing experiential groups in psychodrama is I outline the rules and I say, if you're willing to commit to these rules today, stand up. And what happens is everybody stands up. We get to quickly look around the room and visually see everybody's embodiment of their commitment to these rules. And now everybody's out of their chairs, and I can quickly go right into an experiential warm up, some sociometry, or a psychodrama warm up. As pretty much every group I'm running, most of the groups I'm running are experiential or psychodrama groups specifically. And when we're doing experiential work, usually the hardest thing to do is to get people out of their chairs initially. So doing it through the group commitment to the rules and norms kind of makes it a bit easier. Of course, if there were folks with physical limitations about standing up, or I had group members that were using wheelchair, obviously I would modify that so that everybody could participate in it. What often happens in terms of enforcing group rules and norms is that early on in the group development process, the group leader ends up doing most of the maintaining of group rules and group norms, of enforcing them, reminding group members about them, holding group members accountable. But as that group goes on, what inevitably starts to happen is that the longer term group members start really enforcing and maintaining the rules and the norms with other group members. And that I want to say the responsibility of it, but the frequency that the group leader has to enforce the rules tends to decrease as other group members take accountability and responsibility and ownership of the group and naturally start to enforce these rules with their peers. So, in terms of safety in group therapy, it's helpful to think about the physical layout of the room, as it can really impact the sense of safety and comfort for participants. So this means considering the furniture, considering the decorations within the room, considering the layout of the room. Are the exits clearly marked? Are the exits blocked? Like if we put the chairs in a circle in the group room, we need to make sure we do it in a way that individuals can still get to the exits if there's an emergency. I found throughout my career that many trauma survivors don't feel safe sitting with their back to the door. So I try to set up my group room in a way that it's generally in a circle of sorts, but with no chairs with the back to the door. Or if I'm forced to put a chair with the back to the door, I claim that as my chair so that nobody else in the group feels like they have to sit with their back to the door. It really helps to use a circle of sorts instead of more of a lecture style setup within the group room, in that it provides a visual kind of symbolism that everybody has an equal place in a circle. Whereas a lecture style where everyone's facing the facilitator is more of a hierarchical group structure. So it helps to put the chairs in a circle of sorts. Now we need to make sure that there's privacy and that there's confidentiality within the group room, that the sound isn't carrying into the adjacent rooms or hallways, that the doors are closed, windows are closed, and that there's shades on doors or windows if necessary. We also might have to consider the organization's relationship to the group and the group's place within the organization. I think this is maybe less relevant in outpatient settings, but more relevant in higher levels of care. In my inpatient group, for example, when we first started the group, it was really common for other staff members to pull patients out of whatever group they were in to sign a release form or to make a phone call with their case manager or their therapist or to go take vitamins or medications that they forgot to take that morning or to meet with another professional on the team. And that might be necessary on some level in inpatient settings and higher levels of care. But in facilitating a trauma therapy group, I found that to be really disruptive for the safety of individuals within the group. That if we're in the middle of some sort of trauma processing exercise and one of the nurses knocks on the door and opens the door and says, "Hey, I need to take Johnny. He needs to come get his medications." And we're right in the middle of somebody telling their trauma story or expressing anger or grief. It really disrupts the containment of the group and the safety of the group. So I had to advocate within the agency that it was not clinical best practice to be disrupting a trauma therapy group midway for any reason unless there's an emergency. And that's been the norm within the agency ever since. So you might have to advocate within your agency, create conditions and a container for safety in the groups that you're facilitating. This reminds me of one of social work's theories, the two-client system. Larry Shulman talks a lot about this, that as social workers, we really have two clients. The group is our client, and the agency, the system that we're working in, is our other client. And we have to actively work to create change within both the group and within the agency and system. In terms of disruptions, it also helps to have norms related to using the bathroom or stepping out of the group or using phones or anything else that would distract people so that you can really hold the container of the group. In group therapy, safety is also largely related to group cohesion and related to the matrix of relationships and connections within that group. So safety is often a prerequisite for social engagement, according to polyvagal theory and Stephen Porges' work. So we really have to cultivate safety in order to cultivate meaningful connections. And we also use our relationships to cultivate safety. So there's sort of a reciprocity there between connection and safety. Other experts in the field, such as Gabor Mate, have even suggested that safety is not so much about the lack of threat, but more so about the presence of human connection and emotional attunement within a relationship or within a group. So this is a really interesting way of shifting how we're thinking about safety, that it's less about disruption to safety or the absence of threat or violence or harm, and more so about the presence of connection and attunement. Now, many of the folks that we're working with in group work have been harmed in relationships, in groups, and in community or social settings. And so it makes sense if the nature of the trauma is relational or group or community related, that the healing from that trauma would also have to take place within a group, community, or relational context. And because so much of trauma happens because of other humans in relationships, I really find group therapy to be uniquely positioned and situated to help heal relational trauma. Trauma so frequently leaves us feeling a sense of mistrust, shame, and isolation. And group work is unique in that it provides correction through authenticity, through the normalization of experiences within the group, through the emotional support and peer support, and a sense of shared experience. I'm not the only one that's been through this trauma, this adversity, this experience of loss. When there's strong cohesion within the group, it will naturally lead to the embodiment of trauma-informed principles between the group members, that they'll be contributing to a sense of safety, a sense of trustworthiness and transparency, empowerment and peer support and mutuality and respect, voice and choice, and addressing issues related to identity. So cohesiveness is really related to trauma-informed principles. In the early phases of group development, the participants in the group are primarily going to be connected to the group leader. And so that therapeutic relationship is going to be especially important in the early phase of group development. And part of the leader's task and responsibility is really to develop that therapeutic relationship and a connection to each individual within that group. As the group goes on and moves through the different developmental group processes, and there's a whole nother video on this channel that outlines those phases. A simple way to think about it is beginning, middle, and end phases. As we get into the middle and ending phases of the group, the relationship with the therapist perhaps becomes less important and less central, and instead the relationship between participants in the group becomes more and more important. Early on, the facilitator is often a role model for how others are going to interact with each other. One of my mentors, Larry Shulman, he often says, more is caught than taught. And this is true for us as educators and also for us as group facilitators, that our clients are constantly watching us and mirroring and reflecting and mimicking the things that we say, the behaviors that we're engaging in, and the ways that we're relating to others. So more is caught than taught. Some participants in a group might feel safer with a therapist than they will with other group members, but others are going to feel safer with their peers than they're going to feel with a group leader. There's lots of different ways we can promote safety in our relationship with group members. Sometimes our identity and sharing, being transparent about our experiences or our identities, our social location, our culture, it's going to be really important for group members to feel safe. Another important aspect is our nonverbal communication. What's our voice tone that we're using, our posture, our gestures? Are we engaging in physical contact with our group members, and how? Our personal disclosures and the level of vulnerability and transparency that we demonstrate can really help cultivate a sense of safety within our relationship with our group members. For some group members, our credentials and our role within the organization is going to help them feel safer and more trusting of us. But in general, the level of competence and skill that we demonstrate is going to help people feel safe. And of course, the level of empathy and compassion and understanding, passion that we have for our work, the wisdom that we demonstrate, the knowledge that we offer, and our ethics and integrity that we embody all cultivate a sense of safety with the folks we're working with. So I want to pause here and invite you to take a moment to reflect on your own group leadership. And what are some of the things that you could do as a group leader to help participants in your group feel safer and feel more connected?